My name is Jay Levine. I will be your host and moderator for today's sessions. I'm a member of the Health Systems Innovation Advisory Board. I am a retired management consultant, having spent my entire career advising and working with large academic medical centers throughout the United States. I currently serve on the board of a local community hospital, so I've stayed involved with the challenges of healthcare organization, delivery, and finance in my local community. I want to thank you all for joining us this morning. We're fortunate to have a fascinating group of speakers and panelists who will be addressing a range of topics related to the transitions we're going through in the healthcare industry and the challenges we are confronting and the tools that are being brought to bear to address those challenges. I had the opportunity to address a class on Wednesday at Sloan focused on healthcare issues. And we talked at the beginning of the class about the transition that's going on in the healthcare industry. And we drew parallels between what's going on in healthcare with what went on in other industries that were subject to dramatic federal realignment of regulations. And if we reflect on what transpired in the banking and finance industry, in the airline industry, in the telecommunications industry, and now in healthcare, we can see that there was dramatic disruption in those industries. And that disruption can be characterized by new entrants into the industry, some of them being low-cost entrants, changes in the competitive landscape, consolidations among players to attain scale and to attain market and other advantages. And this transition in the environment now going on in healthcare is ripe for the innovation and the application of technology and analytics and other tools that the Sloan School and other components of MIT are bringing to bear in the healthcare industry. So we have a great opportunity as a result of the disruption in our industry. We're going to begin with a series of opening remarks by some of the leaders of the process. We're going to start with a few minutes by Marty Schmidt, who's the provost of MIT, Ron Williams, who's the chair of the board of the advisory board for health systems innovation at MIT, has a few comments he'd like to make, and Recep Levy, who's one of the faculty directors at HSI, will speak. We're privileged to have the opportunity to enjoy the participation of several faculty at MIT, several alums from MIT, and industry dignitaries and leaders are going to be speaking with us today. We will have some time for questions and answers, questions and I hope answers, certainly questions. And I've been implored to ask you to please use the microphones that will be, quote, tossed around the audience. I'm not sure I know how that's going to work, but I've been told the microphones are tossed around the audience. So if you have a question, please use the microphone. We're going to have a mid-morning break. We're going to have a quick lunch, and we're going to have the all-important cocktail reception at the end of the session, so I hope you'll stick around for that. We're going to start off with opening comments by Marty Schmidt, the provost. Dr. Schmidt has been the provost since 2014. For 6 years prior to that, he served as associate provost. He spent the bulk of his career at MIT. He's had several leadership positions at MIT, including serving as the senior administrative officer responsible for MIT's industrial interactions. He's written extensively and has been involved with over 30 US patents. He's going to be followed quickly by Ron Williams, who, as I mentioned, is the chair of the advisory board, and Ron is the former chair and CEO at Aetna. And the third set of opening comments will be made by my friend Recep Levy, who's one of the faculty directors of HSI, and he has conducted some very important and innovative work to address some of the most complex challenges confronting the organization and delivery of healthcare services in large delivery systems. So I think each of these three individuals will set the stage for today's discussions. So please welcome Marty Schmidt, and Enjoy the conference.
Thanks very much, Jay. I'm going to keep my remarks brief because you've got a really exciting agenda ahead of you, and nothing I'm going to say is going to be more interesting than what follows me. First of all, let me welcome you to the MIT Health Innovations Conference, which is focused, as you know, on technology, analytics, and systems. I think it's really exciting that we're having this conference today at this time. Some of you may be aware that in May, the Institute announced a very ambitious $5 billion capital campaign. One of the areas that the campaign calls out as a priority area of focus for the Institute going forward is, in fact, human health. And I went to the website this morning just to capture what that says. And on the website for the campaign, we basically talk about the statement that defining the future of health through advances in basic science and engineering informed by expertise in disciplines such as management, economics, and political science. So I think having a conference here sponsored by MIT Sloan helps us sort of fulfill that vision for what the campaign is calling out. Clearly, human health is one of the major societal and economic challenges in the US and indeed across the globe. Our current health systems are not able to keep up with the rapidly increasing need and desire for better health and better care at reasonable cost. I believe that we at MIT are well positioned to have an impact on these challenges. Our innovative, collaborative, interdisciplinary approach to solving problems is, in fact, one of our core strengths. I view it as one of our competitive advantages. We can bring together basic science research that informs drug development, biomedical devices, and other engineering innovations, state-of-the-art health analytics, and organizational, economic, and behavioral research to change how health organizations do their work. What really excites me, however, about the agenda you have today is that it brings a strong systems focus to these challenges. We can't possibly hope to drive innovation into health systems without taking a systems approach to the problem. MIT has a very strong record in this area, and I believe we can make a very positive impact leveraging our campus strength in this arena. Today's conference will provide you with insights into the challenges, along with experiments and ideas that are informing new solutions. One of the things I really dislike about being provost is that I get to introduce things like this, and then I have to go and do other things and not enjoy what you're about to enjoy. Having said that, I hope you really enjoy what looks like an extraordinarily exciting agenda. Thank you.
Well, thank you, Provost Schmidt. It's been a pleasure getting to know you, and for me, this room brings back many fond memories as a graduate of Sloan, class of '84. And I have spent all of my career since that time in the healthcare space. And the one thing I can assure you is it is not a system today. And that is the opportunity that we have, which is to bring the kind of systems thinking that is well known here. Provost Schmidt mentioned my background at Aetna. I also serve on the board of Johnson & Johnson, where I've developed insight into the pharmacy space, medical devices, and consumer health. I also serve on the board of a company called Envision Healthcare, which is the largest provider of ambulance services in the country and has 9,000 clinicians who practice in hospital emergency rooms across the country. I have seen the healthcare system from many different angles, and I have very interesting conversations with myself depending on which hat I put on at which time. The one thing I know is that MIT has a remarkable faculty, and what excited me about getting involved with the Health Systems Innovation Initiative is the ability to bring the talent, the skill, the expertise to the faculty, particularly as the healthcare delivery system moves out of the hospital and begins to move into the community, into home, into sensors, into the use of data. Historically, most of the things that are focused on research have been focused on either the clinical event as defined by the use of pharmaceuticals or outcomes done in random controlled trials or in large aggregation studies. The work that I've seen done by the faculty here, I think, sheds meaningful new light and opens up important new windows that can improve the effectiveness of the system. So I think we're going to have a very exciting day. It's a privilege to be here, and it's a privilege to be involved with this initiative. Thank you. Retsif.